Good morning to all those who make this broadcast possible, to Abdiel, who joins us today, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 4,755 people are hospitalized in Cuba. 3,677 are under observation. There are 695 suspected cases and 383 confirmed active cases. Yesterday, we processed 7,066 samples in our various molecular biology laboratories. Of the 7,066 samples processed, 5 tested positive for COVID-19. That's 5 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 685,018, of which 5,948, or 0.87% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. From Pinar del Rio, 110, the most from Havana, with 4,292, Mayabeque, 172, Matanzas, 170, Cienfuegos, 164, Villa Clara, 370, Sancti Spiritus, 766, Ciego de Ávila, 630, Camagüey, 110, Las Tunas, 86, and so on and so forth from all of the country's territories. All of the 5 positive cases diagnosed yesterday are Cubans, confirmed case contacts, and the result of local transmission. This means that 91.9% of all confirmed cases in Cuba since the pandemic began had contact with someone who had previously tested positive for the virus. We were able to determine the source of infection in all 5 cases diagnosed yesterday. Nonetheless, the source of infection in 31 cases reported over the last 15 days is still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 447. All of the 5 cases diagnosed yesterday are women, representing 48.9% of all diagnosed cases on the island, while men account for 51.1%. 1 or 20% of the 5 cases yesterday were asymptomatic at the time of testing. Overall, 61% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 68.6% of cases diagnosed over the last 15 days. By age group, 2 positive cases diagnosed yesterday are under the age of 20. In fact, both cases are under 18 years of age, for a total of 666 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 617, or 92.7%, have recovered from the virus and been discharged from hospital. Meanwhile, 3 people to have tested positive for COVID-19 yesterday are between 40 and 59 years of age. Of the 5 cases diagnosed yesterday, 2 belong to Havana, 2 to Sancti Spiritus, and 1 to Ciego de Ávila. The 2 cases from Havana belong to the municipalities of Centro Habana and San Miguel del Padrón. The 2 cases from Sancti Spiritus belong to the municipalities of Sancti Spiritus and Trinidad, while the 1 case from Ciego de Ávila belongs to the municipality of the same name. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 48.51. Sancti Spiritus follows with 31.76, then Havana with 9.6, Mayabeque 2.08, Matanzas has a rate of 1.53, Artemisa 0.58, Pinar del Rio 0.51, and Villa Clara with a rate of 0.26. No new cases of the virus have been reported in Camagüey, Holguín, Cienfuegos, Las Tunas, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality for the last 15 days or more. Cuba's rate therefore stands at 5.28 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,948 people who have been diagnosed with the virus thus far in Cuba, 383, or 6.4%, are active hospitalized cases. Of these, 380, or 99.2%, are clinically stable. Yesterday, no one died as a result of the virus, meaning that the COVID-19 death toll on the island remains at 123, with a mortality rate of 2.06%, lower than the global rate of 2.90% and the regional rate of 3.31%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 42 people were discharged from hospital, a positive result when compared with the number of confirmed cases yesterday. 32 people were discharged from hospital in Ciego de Ávila, 8 in Sancti Spiritus, 1 in Matanzas, and 1 in Havana. This means that, to date, 5,440 people, or 91.5% of all confirmed cases in Cuba, have recovered from the virus. Today, 1 patient continues to be in a critical state in hospital in Villa Clara, while 2 patients are reported as serious and being treated in hospitals in Villa Clara and Havana. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 388,346 people were diagnosed with the virus, for a total of 36,583,110 confirmed cases since the start of the pandemic. Yesterday, 9,017 people died of the virus worldwide, for a total of 1,062,978 COVID-19 fatalities and a mortality rate of 2.90%. The region of the Americas, which accounts for 48.44% of all cases worldwide, reported 154,408 new cases yesterday, for a total of 17,722,081 people to have been diagnosed with the virus. Meanwhile, 6,075 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 587,047 and a mortality rate of 3.31%. The United States continues to top the list of countries worst affected by the pandemic, with 7,606,594 confirmed cases and 212,773 COVID-19 fatalities. Then comes India with 6,906,151 cases and 106,490 deaths. Brazil follows with over 5 million cases and 148,953 fatalities. In fourth place comes Russia with 1,260,111 confirmed cases and 22,056 COVID-19 related deaths. From the Americas, after the United States and Brazil, comes Colombia, Argentina, Peru, Mexico, Chile, Canada, Ecuador, Bolivia, Panama, the Dominican Republic, Guatemala, Costa Rica, and Honduras. These are the 15 countries with the highest number of cases in the region. Meanwhile, Cuba occupies 21st place on this list. Regarding mortality rates, Mexico has the highest, standing at 10.33%, then Ecuador with 8.37%, and Bolivia with 5.96%. This is the information we have on the behavior of the pandemic in Cuba and the world.